Hello, hello. Welcome, everybody. Welcome to our next ADAPT series presentation. My name is Brooke. I am a program coordinator with Alzheimer's Services. Thank you so much for joining us today in our ADAPT series. As always, we have so many different education and support programs available, and you can find a lot of those on our website through our different events calendar. But then, of course, I can send that in our follow-up email as well. For some housekeeping for today's presentation, we will be recording it and posting it on our YouTube channel afterwards. All calls will be muted throughout the whole presentation. So if you have any questions, comments, things like that, tech issues, please feel free to put those in the chat and I will be monitoring that throughout the entire presentation. I will be sending out a follow-up email after the presentation, which will include a link to an evaluation. Please complete that evaluation if you're a social worker needing a CEU. That is how I will then send your CEU certificate to you. Please ensure also if you are a social worker that your display name on Zoom is both your first and your last name. That is also how I can accurately make sure that your participation is recorded. Alrighty, now I will go ahead and introduce our presenter, the lovely Miss Kathy Lovett. I've known her for years throughout this industry, and she is very graciously spending her time with us today to educate us on such a niche topic that I don't hear a lot of people talking about. Miss Kathy is the co-founder of Cardinal Advocates. She has her Bachelor of Science degree from LSU and Master's in Healthcare from Tulane University. Together with her business partner, Cardinal Advocates provides consulting services that supports families navigating health needs and home transitions. She serves as a patient advocate and concierge consultant, helping clients navigate complex healthcare systems through coordination and care. And I'm sure Ms. Kathy can also tell us a little bit more what she does within this community on the day-to-day, but I appreciate her being here today and sharing this information with us. Ms. Kathy, I'll pass it on over to you.
Thanks, Brooke. I really appreciate it. And thanks everybody for joining us today. I hope everybody has their water or their coffee. I've got mine. I'm ready to go. So today we're going to talk about something near and dear to me as a consumer of healthcare, as I know all of you are as well. I feel it very important for us to understand some of the complexities of healthcare, especially when we are in the hospital environment. So that's going to be our topic today. Just a little bit about myself. Brooke gave you an idea. I am a co-owner of Cardinal Advocates, but I'm also an independent board certified patient advocate. This is a national organization that oversees patient advocates in the United States. And we have to pass a rigorous exam and to better understand the healthcare environment. But I do have over 30 years of experience. I will say this, you don't have to be board certified to be a patient advocate. Anybody can be a patient advocate for a loved one, a friend, or even for yourself. I just happen to take that next step to do that. Most of my clients are what I call solo seniors. That's a term given to the industry for those people that don't have somebody to support them when they are in the health or navigating the healthcare environment, especially the hospital environment. So these are people that don't have family close by. They've never been married. They don't have children. And sometimes they don't even have friends, close friends that they can count on. So just a little plug. I know you've heard this before. If you have not already done so, please, please give serious consideration to who you would recognize as your healthcare partner. You can be any age. Everybody needs to have a healthcare partner. So yeah, that's my plug. All right. I'm also a speaker for what's called the Care Partner Project. This is an organization that was started by a woman who had some unfortunate experiences when her father was in the hospital. And she decided after that that she was going to gather professionals throughout the country to help her come up with checklists. And she did. She got gathered doctors, nurses, social workers, other healthcare professionals, as well as lay people. And they developed free of charge checklists that you can access at any time. I'm going to be talking a little bit more about the hospital checklist, but you can get checklists for how to prepare for a doctor's office visit or how to prepare in the event that you may have to go to the emergency room. Lots of great information on the Care Partner Project, all no charge. I highly recommend that you take a look at that when we are finished with the presentation. Okay, so let's get started. Oh, today's plan. We're going to talk about how sometimes you may have a wonderful doctor and you love him to death, but he or she to death, but it takes a little bit more than just having a great doctor to have a positive experience in the hospital. We'll talk about some tips and resources. We just briefly talked about that with the Care Partner Project, and then things that we can do as a group to help improve the quality of care. Okay, you're going to hear me say this throughout. Bring someone with you when you are in the hospital. And I started by saying how important it is to identify somebody in your life, friend, family, loved one, that can be your support system, somebody that understands what you want when it comes to your health care. So, having all that in place is important before you even go into the hospital. But once in the hospital, real important to have somebody with you. Okay, we're going to go into some statistics. And one of them is 1 in 4 patients needlessly suffer from preventable events in the hospital. This was a study done back in 2023 by Medicare. There are approximately, oh gosh, 36 million people are admitted to the hospital on an annual basis. 36 million. And of those, approximately 9 million will experience some adverse event. So again, you can have some medical complications that shouldn't happen, but there are quite a few in here that should never happen. And we'll talk about that next. These are called never events, events that should never happen when you're in the hospital because it can cause additional medical issues that you didn't even have when you went into the hospital. So, for instance, methicillin resistant staph aureus, MRSA for short. This is what is now called a superbug. This should not happen. We all have bacteria on our skin, but when you have a cut on your skin and you are touched by somebody that has an MRSA bug, you could become very ill just from that simple little cut on your skin. We'll talk about how to deal with that when you go into the hospital. But here are the other ones: blood clots, medication mix-ups, urinary tract infections, also called UTIs, falls, sepsis, blood infection, bed sores, and pneumonia. These are things that should never happen. When you go into the hospital with a medical condition, but you come out with one of these, not supposed to happen. Okay, the other thing, besides the 25% will have to deal with an adverse event, patients forget about 40 to 80% of what they hear. Another good reason to have somebody there that can be another set of eyes and ears for you. It's pretty normal depending on the medication. You're awakened throughout the night, you're getting tests done, you don't sleep well. It's very common for people to forget what other people are telling them, especially when it comes to healthcare workers. So One of the reasons, yes, healthcare is complicated. It's like going into a foreign country sometimes. You're hearing a lot of different things coming your way. People are taking lab work, other tests. You're getting bombarded with a lot of things that you just are not familiar with or even understanding. So it can be complicated. There are equipment, lots of equipment that's in your room. You're being given medication, and some of the medication may not look familiar to you. It doesn't look like what you normally take when you're at home. Lab tests, and do you understand why those lab tests are even being taken? But somebody's in there at 5:30 in the morning taking your blood. And then, of course, you've got a lot of different healthcare workers that are coming in, whether it is your nurse, the nurse attendant, dietary, cleaning, hospitalist, your own doctor, specialist. It can be a lot of different reasons why, again, you could forget some of the things that are being told to you. It is complicated. Oh, and then the alarms. If you are being monitored and those alarms are going off pretty frequently, well, sometimes that doesn't set you up for the best sleeping opportunity either. And if the equipment is not working correctly and those alarms are going off, that can be another issue. So, healthcare workers, they are pretty darn stressed and they would appreciate having a healthcare partner there with the patient. If the patient is sleeping and they don't want to awaken them, perhaps the care partner can be available to answer questions for them. But just keep in mind, they work long hours. They're trying to give you the time that you need, but when they've got other patients calling or they're seeing a lot of different patients on the floor, sometimes the time that you would like to spend with them may not always happen. Especially some of the younger doctors, because they get pulled in a lot of different directions. So the reason being is you just need to be aware of that. Medications. 3 out of 4 patients age 65 plus leave the hospital with an incorrect prescription or no understanding of their medication schedule. Why? 40 to 80% of what they're being told they don't remember. There's quite a few reasons why medication mix-ups can happen. Um, from a handwritten prescription, which doesn't happen very often in the hospital, but it can. And there are medications that sound alike and look alike. There could be other reasons as well. But again, because you may not remember everything that you're being told, it's a good idea to have your care partner there to ask the question, what medication is it? Why is it being used? Or why was it ordered? And are they going to be going home with it? So there's a lot of things that the care partner can answer for you when you are able to better understand. Okay, some of the financial reasons that hospitals are trying to avoid any kind of medical mishaps is that they want to avoid you having to come back in the hospital. So it behooves them to make sure that you do understand your medication schedule, that you do understand all the tests that are being ordered and why, and then to make sure that you are not coming back into the hospital, the care partner needs to understand that as well. When you have a care partner or even yourself, if you're having to come back into the hospital, then you run the risk of, do I need to take more time off of work? Do I need to have somebody else help me at home? Or if I don't have somebody at home, what do I need to do to get back into the hospital? Lots of different questions, but the bottom line is hospitals want to avoid having you come back into the hospital. And in fact, if you come back within 30 days, that can be quite financially detrimental to the hospital. They get dinged in quite a few ways. Okay, so this is one example of a hospital checklist that you can find on the Care Partner project. This one is specific to surgery care and some of the things that you would want to ask for. For instance, when somebody comes in and they're coming to see you, are they washing their hands? Are they using sterile instruments and supplies? Sometimes that's hard to determine, but again, if you have a care partner there, they can be watching that for you. It's real important to have these checklists just for your care partner, if not for you, then they can just be watching to make sure that the things that are important for a good, positive outcome for you is being adhered to. This is just one example, but again, I highly recommend that you go onto the Care Partner Project website. You'll see a whole bunch more. Okay, just going to take a second here to switch gears. When you are looking at a hospital, sometimes your insurance companies dictate where you need to go. And that's fine. Sometimes you have a favorite hospital that you would like to go. And sometimes your doctors say, well, this is where you're going. It's always a good idea to take a look at how your hospital fares in relation to other hospitals in the city. So I'm just going to give you an example of what you can be looking for ahead of time to see how your hospital fares with safety regulations. Okay, I'm going to just do this. Okay, here we go. Oh, just give me a second here.
You might just have to exit out of that screen.
I think, let me go to let's show this again. Hold on one second here. Oh,
I'll come in there, Miss Kathy.
um, share. And I'm going here. No, now going, yeah, here. Okay, and share. Okay, now I'm in my own.
Yeah, you're on there. Mhm.
Okay.
Scoochie. There we go.
Okay, so if you can see right now, I am on hospitalsafetygrade.org. And this is a website that you can look to find out how your hospital fares in comparison, as I said. So I just put in the zip code 70810, and I went ahead and looked at some of the different hospitals that are on here. Let me see if I can get over. Okay, so for instance, Baton Rouge General Medical Center right now has a score of C, and this was from the spring of 2026. You can filter down and look a little bit more at what some of the issues might be. So for instance, let me get down here. Infections. Here you can see that the MRSA infection that I talked about as being a never event, that they are rated not well. C. diff is another what they call superbug. They're average. There is no green on this particular screen to indicate that they are better than average. They're either average or they are worse than average. So what does that mean for us as consumers of healthcare? If your doctor says to you, I would like to send you to the Baton Rouge General, you need to have that conversation with them to talk to him about some of their ratings. He might be able to give you some suggestions or make you feel better, or he might be able to go and talk to the CEO and say, okay, what's the deal? Let's talk about how we can improve these scores. Our Lady of the Lake Regional has A. Now I'm going to, again, I'm just going to show you when you are looking at the score. I'm going to go down here just a bit. So sepsis infection after surgery, they have better than average, but the rest of them is average. So if you have a doctor that says, I want to go to the Baton Rouge General, and you express your concern, it's not that I'm saying don't go to the Baton Rouge General, and I'm sure your doctor will say the same thing. You just need to be more aware. you need to be aware of, are the people coming into your hospital room, are they washing their hands? Are they um, cleaning all of the areas when the housekeeping comes in, and how are they cleaning those areas? It's just something that you need to be aware of. The checklists that are on the Care Partner Project can kind of guide you as to what you need to be looking at when you are in the hospital. I wish I could talk to you all to see if you wanted to see another particular hospital, but you can easily look at hospital safety grade. You can also look at rehab centers to see how they fare. I think that was it. Doctors, you do not get to check on here. These are just for hospitals and for other facilities. I wanted to point out that two hospitals in our area, Lane and North Oaks, chose not to participate. Is that good or bad? I don't know. But again, if you're going to be seeing, if you're going to those hospitals, I would have that conversation with the doctor. You want to be taken care of and know that they are adhering to good practices. Okay, I'll go back to my screen here. Did it come through? Yeah. Okay, and we are there and share. Good. All right. All right. So now we're back. These, besides the hospital safety grade, you can also look at hospitalcompare.gov. All right. Take good notes. I always recommend that a notebook be taken and left in the room so the caregiver can write down notes, especially if you have more than one caregiver. You're going to document everything from who came into the room, what tests were done, why were the tests done? And when you document all that, the next care partner that comes in can know if, number one, what tests were done, but then if there's any follow-up that needs to be done. It might be that the first caregiver or care partner is there from 7 to 3, and then the second one comes in from 3 to 7. Then at least you'll have this information in here that they can look at. And that, I didn't mention earlier, I said bring someone with you. It'd be real nice if you had a team of people that could come in and work different shifts. I know for myself, I'm a day person. I'm up at 4 o'clock in the morning, but nighttime, I'd be sleeping the whole time. So I wouldn't be a real good care partner at night. So you just, if you can have a team of people, that's even better. For the solo seniors out there, that don't have that connection, it's always a good idea to try in advance, at least to get one person to work with you. So again, notebook in hand. Okay, when a doctor or when somebody from the lab or someone is going to be taking a test, what is the plan of care for today? And again, in your trusty notebook, write it all down. What are the goals? What are the meds? When are they going to be stopped? Test results, test schedule. It's just a good idea so that you know, and when the patient is feeling better, you can review that information with them as well. So notebook in hand. There's a lot of people that come into the room throughout the day. And one of the things that you need to feel comfortable with is the physical therapist, occupational therapist, case manager, social worker. Who are these people and how can they be reached in the event that you need them at a later time? Um, People will change shifts. Totally understood. A lot of places will put the names of the people that are working for that day up on a board, and that's great. Sometimes they forget to do that, so the care partner can make sure that the person that's coming in there is actually documented on that whiteboard. Hospitals are really good about taking care of that now. As far as the medications go, we talked about that a lot of times patients are unaware of the medications that they're taking, and sometimes things will sound alike. But the other thing that I want you to be aware of, there's a list called the Beers list, BEERS. This is a list specific for seniors because as we grow older, sometimes our metabolism of medication may not be the same as somebody in their 30s, 40s, or 50s. So it's important that you keep a list, the Beers list at hand, and it can be on, it's online, so it's very easy to make sure that the medication that the person, your loved one is taking, especially if they're a senior, is going to be applicable to their age. Beers list, you can become familiar with that. Hospitals now are doing a great job as far as checking to make sure that the medication they're giving somebody is actually for that person. But like I said earlier, sometimes they can look alike and sound alike. So it's important for the nurses, not only the pharmacists, to start the process, but then when the nurses are on the floor are giving the medication, that they look at all of these different things that the patient should be, what they should be looking at. For instance, their name, the right drug, the right dose, the right time, the right route. Those are all important. And the hospitals are doing a great job with that. That makes me feel comfortable, and it should make you feel comfortable as well. The issue becomes when the patient is discharged. Sometimes, if somebody is on a blood pressure medication, for instance, and what they have at home doesn't look exactly like the blood pressure medicine that they got at the hospital. Because they miss 40 to 80% of what they're told, they may not initially remember that that medication was for blood pressure, and they just read the recommendations, the dosage, and they take it at home, and then they take their blood pressure medicine as well. So sometimes they're double dosing just because they don't look alike. So it's very important for you to make sure that at some point you relay that to the patient. Always a good idea, if you can, to meet with the pharmacist before you leave the hospital to make sure that there is an understanding of what is taken at home and what you're being given at the hospital, how they interact, and what you need to be aware of. Test results, lab results, again, in my trusty little notebook, you always want to make sure you write down what it's being taken, why the lab test is being taken. And then not only that, but what is the follow-up going to be? Does the doctor come in? Does the nurse come in? Who is giving you the results of those lab tests? It's also a good idea to document these, because when you get your bill, eventually you'll get your bill, you want to make sure that what you have documented is actually on that bill. What if you were charged twice for the same test, but the test was only done once? Well, this is a great way to document when that was taken care of. So document everything on your trusty notebook. Okay, this is when you're going into a hospital, if you haven't been into a hospital recently, or even if you have, I liken it to going into a foreign country and you're trying to learn a new language. And I have been in patients' rooms when doctors come in and they will start talking and saying things that make absolutely no sense to the patient. Thankfully, because I have a little bit of a healthcare background and I can understand what they're saying, I have no problem in saying, could you explain that to the patient in a simpler way? I have no problem in doing that, because if you don't understand why you're there, what you're having done, and what the recommendations are going home, then that's not going to be a successful outcome. So slow them down a little bit and just say, hey, I just need to better understand what you're saying. Just remember, if you're going to a foreign country, if you don't understand the language, it can be very, very difficult. When you're considering things, for instance, surgery, or if you're needing to get a second opinion, it's always, go ahead and look at some of the information online. There's some good information. There's some bad information as well. So you want to look, but you always want to verify. I've become good friends with ChatGPT. We have a relationship. I don't know if any of you have done that before, but sometimes I feel like I'm talking to somebody very easily, and I can say to them, for instance, I want to know a little bit more about superbugs and how I need to prepare myself before I go in the hospital. You'll get a lot of good information about what you need to prepare and what those superbugs might be. You might also want to look online to see, okay, I'm going to have knee surgery. What do I need to be prepared for? What is the success rate? Just again, you can do the research, but you have to be able to verify as well. Um, yeah, and I'm sure that there are some other AI driven um, sites out there that you could take a look at. I just have to be, like I said, my friend Chat GPT, and I get along real well. Okay, hospitalists. Um, for those of you who have recently visited the emergency room at a hospital, and certainly at a hospital, you may not see your general practitioner anymore. You might just see the hospitalist. And you may see that hospitalist not only in the ER, but they may travel with you throughout the hospital as well. For those of us that are having to go into the hospital, your normal stay is about 3.5 days. So you want to make sure that you know their name, you understand what they're telling you that you need to do. You may see that person again. It may be another person, but they all work together, and hopefully they will have already discussed your your particular medical condition and what needs to be done. But yeah, the hospitalists are a familiar word. If you're not as familiar with that term, then you will be pretty quickly when you are into the hospital. But certainly Google the term hospitalist. These are usually employees of the hospital. So yeah, so you should know them just as well as you know your nurse's name, or any of the other people that come into your room. Okay, this can be a difficult. Sometimes it's easier to tell or remind a 3-year-old that they need to wash their hands than it is an adult. But washing your hands before, and I'm talking as a healthcare worker, washing your hands before you touch a patient is imperative to avoiding any of those never events. But as I said, sometimes it's easier to teach a child than it is an adult. So some hospital rooms will have a sink in the room, and you can actually see them washing their hands. But what if you can't see it? Well, one of the recommendations is to make sure at the patient's bedside that you have hand sanitizers. It's not easy to ask a doctor or a nurse whether or not they wash their hands. But having this and making the comment, I appreciate the fact that you probably washed your hands, but I am so concerned about my loved one's health or my own health. Would you mind please using the hand sanitizer as well? Will it go over well? Yeah, it should. It might not always, but then you have the upper hand to tell the person, again, please, I understand, but if you would do this for me, I would greatly appreciate it. I have heard of some healthcare professionals that have balked at that, and the family member or the patient has just said, then I'm going to ask your supervisor for another healthcare worker. But most of the time it works. Again, if you don't see them washing their hands, please consider having this at the bedside. I have also gone so far as to bring my own germicidal wipes. Yes, I clean off the area where the food is, the handles on the bed rail, the bathrooms. Yeah, I have done that because I want to be sure that the place is as clean as possible. If somebody comes into the room with gloves and they don't take those gloves off, that could be a problem as well, depending on where they were beforehand. They might have put the gloves on right as before they got into the room. That's fine. But if I see them touching the handrail, I will be getting out my wipes to make sure that the bedside is clean, especially in the bathroom. I want to make sure the toilet, the sink, everything is clean. You're doing this to protect yourself and your loved one. So yeah, just might need to take that little extra effort. I don't get people flowers when they go to the hospital. I'm usually getting them things like this so that they can feel safe and secure. I know I'm a little bit of a safe and secure person. Okay, stock up on these, again, the hand sanitizers. They're not all the same. You want to make sure that you get a good one. And I have, um, well, I've got small little bottles that I get from Amazon of Purell, and I put those, they've got little clips on them, and I put them on the side of my purse or in my car. I just clip them on. You don't have to carry these big bottles around with you, but it's just something that in the event you have been exposed to something, grocery stores, after the grocery store, I'm always putting this on. Um, I learned a lot after COVID. I don't want to be paranoid. I just want to be aware. And that's my whole point of letting you know that as well. Okay, these wipe. As I told you, some of these, I will carry these into the hospital room with me if I'm with my loved one. Some of the bugs, especially the super bugs, all you would need is just some wipes. But for other bugs, you may need bleach. And if you find out, I don't, it's not necessarily commonly known, but if you found out that somebody or your loved one has C. diff, even more reason to have bleach to try to kill that bug versus other bugs that can just be used with a Clorox wipe. I also have this neat little bottle of spray. Okay, fall risks, another never event. Um, Horror stories of people somewhat awake, and because they get up to go to the bathroom themselves at their home, why wouldn't they do that? Well, a lot of reasons. The medication that they're taking may be a problem that causes them to lose their balance. And again, you could run the risk of somebody slipping when they get out of the room, or excuse me, out of their bed. Um, if you know of a person that has a fall risk or has the potential to be a fall risk prior to them going into the hospital, then these slid resistant socks are always recommended. Hopefully, the hospital personnel on the floor will be aware of the risk factor, and they usually post signs to indicate that. Real important that somebody doesn't try to get out of their bed by themselves. And of course, the care partner, if they're there, can help them or call for assistance, because that, again, never event. Alarms. Sometimes if you are on a heart rate monitor or a blood pressure monitor and the alarms keep going off, you might find that initially personnel are coming into the room to check it. But sometimes those alarms are going off so much, it's called alarm fatigue, that they may not even respond to the alarms. So if you are with your loved one, or if you are aware enough and you're the patient in the bed, don't hesitate to let the clinical staff know that the alarm is going off, because it could be that there is some good clinical reason why the alarms are going off. But just be aware, alarm fatigue could be a problem. Watchful weekends. When we're going into the hospital, one of the recommendations is to try to avoid having surgery on a Friday, because on the weekends, staff is usually not as great as it is during the week. So if it's possible, and you can schedule it, the recommendation is to schedule for Tuesday, Wednesday, Thursday. Hospitals are going to try to get you home if it's possible, as soon as possible. But just be aware that the weekends are not always as well staffed as during the week. Um, and that's something you can have a conversation with your doctor. If it's an emergency situation, then you don't have a lot of choice, but your care partner just needs to really, really take good notes. This is something that was instituted, oh gosh, years ago, that in the event you are in the hospital and your care partner notices that you are not doing well and they are calling for assistance and there's no assistance coming their way, you can actually call 911 in the hospital, and it'll be very interesting to see how many people start coming into the room very quickly. It's not that they don't care, but they might be with another patient. And they might not hear your calls. So don't hesitate. If you are in there and your family member is not doing well, call 911. You'll get a good response at that time. Um, this is an unfortunate situation for a lot of seniors that are going into the hospital. Sometimes they may present with cognitive issues that are unrelated to anything but the infection. They might have a urinary tract infection that can cause confusion. And sometimes there is that feeling that, well, they're confused because they have some cognitive issue. But in fact, it could just be the infection. You are aware that these are symptoms that are coming up that are not normal for your loved one. So being aware of that, it's a good idea to point that out to the healthcare personnel. Any one of these, staph infections, urinary tract infection, drug interactions, all of those things for somebody, your loved one, that is abnormal, it's a good idea to let the healthcare worker know. Okay, discharge. I hope I'm okay with time. I'm doing okay, Brooke? I think so.
Yes, doing good. It's only 12:42 right now.
Okay, good. Very good. Um, at discharge, let's say you're ready to go, your loved one is ready to go. This is not the time for the healthcare personnel to say, hey, go get the car because they'll be ready for discharge. Mm-mm. You want to stay right in that room and using your handy little notebook, write down all the discharge notes. That way you can, again, review those with your loved one when you get home. And it may be 24, 48 hours before your loved one is feeling well enough to understand what are in those notes. Just a little side. When you have a loved one that's in the hospital, but you don't live with that loved one, and you know that that loved one or friend is not able to take care of themselves when they go home, you can have that conversation with the healthcare personnel to say, this is an unsafe discharge. And then they are responsible for working with you and with the patient to try to make it a safe discharge. Meaning, do they have food at the house? Do they have somebody that can check on them to make sure that they're taking their medication correctly? Are they taking their blood pressure the way that they should be? Is there somebody there to help them, to monitor for them? Because again, it could take a while before the patient recovers from their hospital stay. So that having somebody there with them is going to be very important. But regardless, write down the notes. Okay. If you are the type of person, and I am one of them, that you are being given information, and sometimes you have a tendency to forget what is being said, ask if it's okay to record the conversation so that you can make sure that you have captured everything. And you can have your loved one, your friend, listen to those notes as well. Or even the doctor that you go to see, because a lot of times they will say, please follow up with your general practitioner, your family medicine doctor, and they can be listening to that as well. You want to make sure that you've covered everything. It's so important for a successful outcome. Okay, just for those care partners in the group, you want to check in with them as often as possible, at least daily, so that you can avoid that readmission. Again, hospitals don't want to see you if possible, and especially not within that 30 days. But sometimes things happen and you need to, so it's very important to keep on top of everything that's going on a day-to-day basis. Okay, that is it for me. Are there any questions?
Wonderful. Thank you so much, Miss Kathy. I think that was a very, very nice overview of how to prepare ourselves and then also for our loved ones for hospitalizations. And I think, especially for those who are on the call that work within healthcare, that also is just really good reminders for us of what are our clients or patients thinking of when they come into our office and how can we better serve them from concerns that they may possibly have. So our chat is open. We still have about 15 minutes, so we have plenty of time to answer some good questions. So while y'all go ahead and write some questions in here, I will ask a couple of questions for Miss Kathy. Miss Kathy, can you tell us a little bit about your role as a patient advocate? I know you mentioned a little bit about how you support a lot of solo seniors or older adults who don't have those built-in support systems. Can you talk to us about what that is, and then also where if we see a client or a patient come in that doesn't have that support, how can we better support them and connect them with a village, so to say?
I think the village part of it is probably the key. And one of my goals is to try to get a solo senior support group. They're just starting to take, or people are becoming more aware of them throughout the country because there are a lot of solo seniors out there and they need to be able to connect with other people. But the key is you've got to have somebody that understands you and will follow through with what your wishes are. Um, so I think at this point, Brooke, I don't know if I have an easy answer for those people that don't have a support group, but I would say that if they needed some assistance, keep in contact with me because my goal is to try to get a solo senior support group started in the Baton Rouge area.
That's wonderful. Thank you so much. Okay, another question is, let's say you were in the hospital, either yourself or you're in the hospital with a loved one, and y'all are experiencing issues, either from uh, not well done medical care or whatever. Y'all are experiencing issues. How should a family go about expressing those concerns?
Okay, that great question. And just happens to be a checklist on the Care Partner Project website. So I highly recommend you take a look at that. But there are levels of within the hospital that you can talk to. Sometimes hospitals will have a patient advocate on board, but they do work for the hospital. So they will take your information and escalate it as they see fit. Uh, Going to a nurse manager if immediately, if your care is not, if you have some concerns about your care, I would highly recommend doing that. And then it might escalate from there. I have had situations where people have called me because they felt that they had an unsafe discharge. Uh, it- as I mentioned, hospitals will do everything that they can to try to assist and to help you. Um, but sometimes that assistance may be not exactly what the family wanted. It may be that for a term time period, they may have to go to a rehab center for some additional care. Um, So that's one situation, but within the hospital, you should go to the nurse manager first, and then they'll escalate that up.
Fantastic. Good deal. Another question is a lot of times, especially in our work caring for people with dementia, we work a lot with advanced care planning and using somebody's healthcare wishes from that they've communicated to us years ago and then communicating those on behalf of our loved one to be their advocate. Can you talk a little bit about that and how to prepare or organize or bring to the hospital staff what our loved one with dementia, what their healthcare wishes are?
So did I hear you correctly? They had information, they have, for instance, a living will, and they have communicated that with their loved one?
Yes.
Okay, so chances are, but not necessarily always the case, that they've already seen a lawyer that has written up. I know for myself, if I have a client that is cognitively impaired, it is imperative that I be listed as a person that they can talk to. If the person, my patient, my client, cannot easily speak for themselves, then I can be their well, their advocate. But it can't be just anybody that comes in. It really would be a good idea to have that legally documented, that it's okay for this person to speak on my behalf. I also recommend that that be revisited pretty frequently, and I also recommend that you have not one, but two or three people in the event that the first person that you have named, especially if it was done years ago, is no longer able or no longer willing to do that. You should have some backup. Did that answer your question, Brooke?
It did. Thank you so much. And I think that calls into mind just a really good example of, all of our physical things that we bring with us to a hospitalization or a doctor's appointment or things of that nature, like hand sanitizer, all of that stuff. Um, that is all really important, but it's also very important to bring with us all of those things that aren't tangible and just have within our mind so that we can properly make sure that those efforts are done as well.
Yeah, I also recommend that we all have a written copy of our medical record.
Mhm.
I recommend binders so that you have the list of your medical history. And I would think this is especially important for people with cognitive issues because if they don't remember all the surgeries that they had, or they don't remember all the medications, it's easy for the loved one or even EMS to grab that binder, and so that they have some quick access to vital information that they might need to treat the patient.
Absolutely, absolutely. And within there, you could also have copies of if they have a DNR or what their current
Yes.
list of medications are, what their list of allergies are, all of that stuff. Absolutely.
Yeah,
We actually have something like that here at our office. We call it a caregiver binder. So if anybody that's on the call today is wanting something like that, we have one of those. I'm happy to connect you with it.
perfect. Yeah.
A couple of comments. We have someone that said that they're a social worker at St. Tammany Hospital and they have a great patient advocate department and they're very important to the organization and that they're very thankful to have them. That is such wonderful news. I'm happy for you and clients and patients that go to St. Tammany Hospital. That's so important and that's a sign of good health care.
That is wonderful. That is wonderful. In this discussion, I know we're talking a lot about seniors and the power of attorney and healthcare proxies, a lot of good things. But one thing you've got to remember, especially for those of you who have children that are going off to college and they're 18, it's really important to have that discussion with your child because once they leave, and if something happens to them, if you as a parent are not identified as being able to talk to them, you will have not too much control.
Yeah.
So it's real important to have all that paperwork. And I recommend you go to the lawyer and take care of all that beforehand.
Yeah, definitely. It's something that, any of those advanced care planning or having our wishes known, that's important for any adult. And that starts when you're 18. It seems like you're still a kid if you're just going off to college, but really, I mean, it's important to have those things out for
Yeah,
sure.
yeah.
Another question that we have, of all of the tips that you have, what would the one recommendation be that you feel you would give to any family prior to a hospitalization stay?
Hmm. Oh, goodness. I think if it was just one thing, I would go to this hospitalgrade.org, hospitalsafetygrade.org. I would like to know how they are faring as far as avoiding infections, because if my loved one's going into the hospital, I want them to come out with not additional issues. So, yeah, I think I would go to the hospital safety grade first.
That's great advice. And I also think that's really important for people who are long distance care partners. A lot of our loved ones who live here in Baton Rouge, but their loved one that they care for lives in another state, and you're not familiar with what the healthcare systems are like over there, or if it's in a very rural space, you may not be as involved or as knowledgeable of what the systems are like, or so I think that is very important to know and just to have better information as a consumer, as a patient. Um,
Yeah,
Excellent. And
yeah,
also great for any of those that work in those healthcare systems to recognize where do we need to do better? How can we better serve people? Even probably people on the call today work at Baton Rouge General, and they were like, "What
yeah,
me?"
yeah. Yeah, and I know the Baton Rouge General was not like that before, so I'm not sure exactly what happened. But it's just making them aware. What do we need to do to tighten up this area?
Yeah,
Washing hands is a big thing. So yeah,
yeah.
whatever we can do to encourage those that are taking care of our loved one, or for ourselves, make sure you wash your hands.
Yeah. And really, any healthcare setting, I mean, we're all human. Nobody is perfect. No healthcare setting is perfect, even if you have a straight A grade. But, for all of us, it's just good to know how can we better provide care for others? And then how can we expect quality care for ourselves? Because that is what we all deserve within care.
Absolutely, absolutely.
Um, okay. Let's see. A question just came in. How should this information get out to the community? So I guess that's kind of like a public health question, but also how can people access a lot of these, the checklists that you talked about, any of these things, how can people get that information?
Well, first of all, I am willing and able to come and talk to whomever. This presentation just touched on, gave a great overview of all the information that is available. But thecarepartnerproject.org, that has all of those checklists, excellent checklists, to help prepare people. How to get that information out? Um, well, other than me going and talking to different people, I'm not exactly sure, but I do speak to Ollie. I get out there and talk, discuss this with Ollie in New Orleans and here in Baton Rouge. I try to get the word out, but yeah. And if people are interested in being speakers for the Care Partner Project to help me get that word out, it's easy to sign up and easy to do.
Wonderful. And I will put those links and the hospital grades links in and your contact information in the follow-up email, just in case anybody needed to connect.
Yeah, absolutely.
Um, Fantastic. Okay, just a couple more minutes if anybody else has any questions. Let's see. Oh, a question about somebody who's out of state. Would you be willing to do communication? Is this type of communication relevant just for Baton Rouge, Louisiana, or is it something that can be utilized around the country?
Around the country, without a doubt, without a doubt. Um, And if I'm understanding correctly, if I needed to assist somebody, I'd be happy to do that. Um, but there are Care Partner Project people, speakers throughout the country, and they love talking about this kind of stuff.
Yeah, and they probably have a directory on their website as
They
well,
do.
but I
They
will I'll link that website and Kathy's contact information on our follow-up email. We just have about one more minute, Kathy. Thank you so much for your time and your education for us here today. Are there any just closing statements that you'd like to close out with?
Well, just based on the questions that were asked, the other thing that I would recommend is for people to get very chummy with their pharmacist.
Mm.
They are unbelievable resource. Sometimes our local pharmacists are busy, but I know of pharmacists that work independently, and I had a client that was just taking a lot of medication, and we couldn't get through to their local pharmacist easily. So I put this person in touch with a colleague of mine, and she was able to go through and identify all the different medications and medications that probably were not working well together. So I just thought the information was invaluable. So for me, it was a lesson in how important it is to know your pharmacist.
Definitely. And that also could be a good thing to do and add to your checklist for after a discharge, after a hospital discharge, whenever you may be leaving with extra prescriptions and kind of following up a part of your follow-up plan.
Yes.
Wonderful. Thank you, Miss Kathy. Thank you for everybody that joined us today and joined us for our Adapt series. We'll have another one coming up in September and then one more in November. But if y'all have any needs from Alzheimer's services, I'll send our follow-up email. We're always here, happy to answer any questions. But this concludes our meeting for today. Thank you, Miss Kathy, for your time with us.
Yeah, no problem. Thank you.
Thank you. Everybody have a great day.